Hello folks, Emily Pharmacist Witch here. In this video, I'd like to talk about psychedelics, a subject that I've been curious about for a while. And the subject of psychedelics first piqued my curiosity in a medical pharmaceutical pharmacist context. I was sort of passively following the trials for MDMA, for PTSD, and I was just generally curious about the tryptamine psychedelics, LSD, ayahuasca, psilocybin, DMT. I was interested in their pharmacology, how we have this network in our brain called the default mode network. It's 4 different parts of the brain that sort of work together to create our sense of self. It's the network in our brain that lights up when our mind is wandering, when we are kind of self-referencing. There tends to be more activity for folks who have depression in this area of the brain, like rumination, which is all, I think, very interesting. It's sort of like if we could pinpoint the ego to a network, this might be what that is. And so the way that these tryptamine psychedelics work, in this default mode network, we have a high concentration of a particular type of serotonin receptor, the 5-HT2A serotonin receptor. And so these tryptamine psychedelics will agonize, or they will act on these particular receptors, which then leads to vasoconstriction, less oxygen flow to that area, the DMT. And when there's less oxygen flow, there's less activity. So imagine your ego being less active. In that setting, connections are able to form elsewhere in your mind that wouldn't normally be allowed to form. It's sort of like it's been compared to a coat of freshly fallen snow in the mind, where you can kind of form new tracks, new pathways that are not dependent on going through that sense of self, that default mode network. And so because of these new pathways, we're finding that folks are sometimes able to really benefit in terms of treatment-resistant depression. We're having some relief, PTSD, we're having some relief with some of these medications, these plant medicines. So, all of that is to say, I was first, fascinated by these medicines in a pharmaceutical context. And then I started to dip my toes into the spiritual space and to really take on this identity of the witch. And we know that these plant medicines have been allies in a spiritual setting for ever, used by the witches of old and shamans and other spiritual healers and leaders. So I got kind of curious about them in the spiritual setting. And I ended up being curious enough to reach out to a church that has a religious exemption to administer psilocybin as a sacrament. And I went and I just had a very small dose, a micro dose of psilocybin, but the whole experience was really beautiful. It was with a whole bunch of other people. It was a ritual, right? We were there together having a shared experience, a walk on a beautiful trail, and we were guided. We had 2 guides that are also ministers. So it was a really profound experience. All of that said, it was obvious that the church was struggling. They were at capacity. They were taking care of a lot of people with these plant medicines. So I'll kind of come back to that in a moment. I also recently attended Harvard University's psychedelics, 4th annual psychedelics conference last month. And it was an interesting take. It was in the wake of Massachusetts ballot question number 4 not passing. So this was a ballot initiative to make their regulated therapeutic access to psychedelics legal within about 2 years. So they were going to have 2 years to put some guardrails and some processes in place to then in 2 years have this be more broadly available for folks. So that did not pass. So this conference happened in the wake of that, and it happened in the wake of the FDA rejecting MDMA for PTSD earlier in the summer. And it was interesting to see how the conference handled it all. There was still hope that these medications would find their way into our medical system. Rick Doblin has been carrying this torch for a long time, and he's clearly so passionate, and he's taken our awareness and our knowledge of these substances so far in his time bearing this torch. There was also some interesting dialogue. One of the presenters at the conference, Tristan Angier, had themselves had an experience with psychedelics and was really advocating against, not strongly against, but against having these medicines be administered in what they call no spaces, or spaces that are impersonal, spaces that don't feel like that people don't feel a connection to when they're taking these medicines. And really that's, it's tricky, because as these medications are being studied in a medical context, they have to be studied in a medical context. And what that means most of the time is, we're doing it in a hospital, in a doctor's office, in a dental university space in one case. And it's hard to ensure that these kind of no spaces, these spaces that are meant to be very sort of sterile, that are meant to be functional rather than comfortable, it's hard to really cater the space to the person. And we know how much that mindset and setting are vital to the psychedelic experience. So it was interesting to think about whether these medicines belong in the medical field at all. And another piece of the dialogue that happened at the conference was the expense of psychedelic assisted therapy, of using psychedelics in the medical context, right? There's all of the lead up, the preparation to, before someone takes the medication, and then the journey, the actual day of the medication. There have to be two therapists present for the whole time, and that's a full work day. And then how much integration are you doing after that experience? That all requires a lot of hours. So there's this huge cost involved, huge time, and then also the space just maybe isn't quite right for the experience that people are having, which does end up being, for a lot of folks, a spiritual experience, right? We're studying these medications for depression, for PTSD, for end-of-life anxiety, all of these diagnoses, but often when that default mode network goes quiet, I shouldn't say often, sometimes when that default mode network goes quiet, when that ego is quiet, people have these mystical or spiritual experiences where they feel connected, they feel at one with everything, they feel that there is more than just themselves. And so is the medical field, is the medical office the best place for an experience such as that? History has had these medicines administered within spiritual homes by spiritual guides. What does it look like moving forward? And the fact that the FDA rejected this application for MDMA, the fact that the cost is so possibly prohibitive to having these set in the medical space, is it a fault of the medicines, or is it maybe a fault of the way our medicine system is working? What does it look like next? Should these medicines be reserved for spiritual spaces? Is there a way to integrate the spiritual and the medical? And that's, I think, the question that I'm grappling with as a pharmacist witch, right? Is the future of medicine spiritual too? Do we find a way to have them all be in harmony, so that we're helping people not just with their physical symptoms or their mental symptoms, but we're also looking at it more globally in a spiritual context. I don't know, I'm curious what other people think, especially folks who have maybe had one of these heroic experiences, a journey with one of these psychedelic medicines or plant medicines. Do you feel like they belong in the medical field? Do you feel like the medical field will ever get to a point where there is synchrony there? Anyway, if you're looking to have some conversations about this, I do a chat every Monday at 7 p.m. On Zoom about consciousness and the mind, and I would love to have anybody who wants to talk more about this join me. I'll put the link in the description. Thank you all.